So,
Interior interosseous.
so just to show a hand, how many
Innervated
people
muscles.
needle the FPL? Is it, so what, a third of the group, maybe half of the group needle FPL? Yeah, the FPL is a good muscle to examine. And if you're looking for anterior interosseous nerve involvement, it's a good muscle to choose because it's relatively easy to find and easy to needle. But the other advantage of it, or other reason why you might do it, is in the C8 radiculopathy. And like I said, like earlier today, some people come in with these gnarled hands, farmers, laborers. They have a lot of trauma. You start finding things in the hand muscles, and you don't know, is that just trauma from the hand, or is there actually a higher neurogenic lesion? And so, and the hand is all C8T1, so you need to find other C8T1 muscles that are outside of the hand, and FPL is a good one. EIP is another good one. I'm going to show that in a little bit as well. But that's kind of the most common scenario. The other time in which we will needle FPL is in a condition called inclusion body myositis. I don't know, do people familiar with IBM? And that disorder, for reasons I think no one really knows, the FPL and FDP, the flexion, are affected very early in the course of these, and oftentimes the most affected muscles. And so whenever I have a case that's suspected at IBM, I always needle the FPL for that reason. Now to find it, everyone, if you want to do it on yourself, you can palpate the radial artery, palpate the radial pulse here on the radial side of the forearm, and just kind of march up the arm a little bit. And usually about a third of the way up, that's about where hers is, you lose the pulse. And that's right where the pulse then goes between the superficial layer of muscles and the deep layer of muscles. And then go ahead and bend your thumb tip down. Yeah, and then right there you can feel her. I can feel her muscle bulk. And if you do it to yourself, you should be able to feel your own. It really kind of pops out. This is a remarkably big muscle for what the function it does. At some point in our evolutionary past, but this must have been an important function, but because it seems way stronger than it needs to be, and way bigger. So, and it's also not terribly deep. It's not as deep as you would think, but as we talk about it being in the deep layer and such and such. So I'm just going to take. All right, so I'm going to put the needle, so I have palpated the muscle belly just inside the radius here, just inside the bone. Slide it down into the muscle. And you can see I'm not very deep, but I'm probably in the muscle there. And now bend your thumb tip down. Keep bending it down. I'm not quite in the right spot there. Now I am. And look how, that's not, that's what, 10% of the needle length there? Maybe 15% of the needle length there that I'm in. So it's not particularly deep. Take that out. Now the one thing you do have